Alright, so for the next criteria which we're basically going to look at, which is used to classify acute kidney injury, we're looking at the AKIN criteria for acute kidney injury. AKIN criteria for acute kidney injury. So for the AKIN criteria, you could actually see that the AKIN criteria is kind of like a modification of the rifle criteria. Alright, so it's having lesser things, you understand, it's less crowded, but actually gives you the right information. Do you understand? So let's look at the AKIN criteria. So it said that it was developed by the Acute Kidney Injury Network. So this AKIN here, this is what it means. So it's a widely used system for diagnosing and staging acute kidney injury. So you can use this to actually confirm that acute kidney injury exists. Then you can use it to know at what level is it existing. So it builds upon the rifle criteria but aims to improve sensitivity and clinical applicability, okay, by focusing on short-term changes. Do you understand? So to be diagnosed with acute kidney injury using the AKIN criteria, a patient must meet at least one of the following criteria, and that is within 2 days. Okay, so for the serum creatinine, that's you trying to check out how the kidneys is able to be producing creatinine. It should increase. Okay, that's to tell you that the kidneys are not putting it out of the body like they used to. Okay, so it increases at about 0.3 or greater than 0.3. okay, then, or let me say you did a baseline serum creatinine, that's 2 days that the patient came to the hospital. So in 2 days you are trying to measure the creatinine and you are seeing that the creatinine has increased for over 1.5 times. Okay, then urine output is actually basically low, okay, for about more than 6 hours. Okay, so now looking at the staging system properly, I told you guys that this image summarizes it in case you want to look at the AKIN criteria and the rifle criteria and compare them. Okay, but let's just talk about the AKIN criteria now. For the AKIN criteria, what I want you to do for me is I want you to actually pause this video and observe the serum creatinine criteria and also observe the urine output criteria. Okay, the serum creatinine criteria, you are basically trying to look at that waste product that the kidneys were supposed to put out. Okay, then for urine output, you're actually trying to look at how much of urine, okay, where the kidneys being able to produce. Let's start serum count. Okay, so we have the stage 1, we have the stage 2, we have the stage 3. Now I want you to do me a favor by pausing to look at the parameters that are used to classify these stages. Do you understand? Because it's not all about just talking about it and going. It's good for you to actually pause and observe how the values are declining as the stage gets worse. Okay, so patients on renal replacement therapies are automatically classified as stage 3, regardless of any criteria. That's another thing you should note. So key differences of this AKIN criteria from rifle, because many people will actually want to what's the difference between the two. The key differences is this: AKIN uses absolute creatinine changes for early dictation. It eliminates the loss or end stage renal disease categories. It requires changes to occur within 48 hours, making it more time sensitive. Okay, so that's it for this.